Good afternoon. It's Friday, May the 8th. I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners. And on behalf of the entire Board of Commissioners, I'd like to give you a quick situation report on COVID-19 in Iredell County. Before I get into that, I would like to give a shout out to three professions: our nurses, our teachers, and our law enforcement officers. This is a national week where all three of those professions are recognized for the contributions they make to the collective good. Especially, I'd like to point out the work that our teachers have done to be able to react in short order to transition from in-person instruction to remote instruction using the laptops and the internet and other aids to be able to keep our kids on track. For those that didn't have internet, they prepared take-home packages, and our county libraries have been open for those children who have not been able to get good coverage wherever they lived on appointment. So all of those agencies working together have met a great challenge. I'd also like to thank our law enforcement personnel daily, putting their lives on the line to protect you and me. And finally, for our nurses. You know, our nurses come in a lot of different types and work in a multitude of different locations. We have nurse assistants, CNAs, registered nurses, BSNs, nurse practitioners, nurse anesthetists, nurse midwives. The list goes on and on. But what is common is that they all provide a close personal touch to provide care with compassion and empathy. And what they bring to the table is what makes the healing professions so different, and they are so much on the line for us today, on the front lines, at risk to themselves. So we want to lift them up in our prayers and give them a hearty shout out yourselves when you have that opportunity. The current statistics for Iredell County: today we have 142 confirmed cases of COVID-19. We have, out of that 142, 48 are presently isolated at home. 83 have recovered or are no longer in treatment. 5 are presently hospitalized. That's down from 6. And we've had 6 who have passed from COVID-19. The order for the governor that was issued on May the 5th implemented Phase 1. This is Executive Order 138. Phase 1, which was foreshadowed in his teleconferences of the last 2 weeks, only 3 days before May the 8th, today, when it is to go into effect, is a rather complex order, has a lot of detail. And I would invite you to go to our website on the county webpage to be able to view in its entirety Executive Order 138, which lays out in detail what you can and cannot do. I will say this, in general, it has done away with essential business and non-essential business distinctions, and instead has focused on how you do business, not what you do, but how. And how is focused on maintaining social distancing, washing your hands, keeping work surfaces clean, and wearing a mask to be able to protect others. So businesses should have a business plan about how to implement these restrictions. And if there's any questions about the legalities, I recommend that you discuss that with an attorney before you leap. Phase 2 is supposed to begin. This Phase 1 under the governor's executive order basically is lasting from May the 8th today until May 22nd, unless it is further extended or it is modified. The governor has set out a number of different data-driven criteria to be able to proceed from phase 1 to phase 2. If you go by the duration of his order, that sort of foreshadows that the presently anticipated move to phase 2 would likely be on May 22nd, so a 2-week phase 1. However, if the numbers are going significantly in the wrong direction, he may well extend phase 1. So that's why it is very important that we all focus on practicing personal responsibility while we execute our personal choices. In terms of our own increase over the last couple of weeks, what we've seen really is a stabilization of cases in the southern end of the county. They've increased incrementally. What we have seen is the bulk of the cases that have presented themselves in the last week to week and a half have been in the central area of the county as well as the northern end of the county. We obviously have different population densities, but now if you look at the spread, there's 70 cases in the southern 4 zip codes of the county, and then everything else up to Interstate 40 contains 49 cases, and everything north of Interstate 40 has 23 cases. Still heavily weighted in terms of raw numbers to the southern end, but when you look at population and per capita infection rates, it's a different story. So it's important, no matter where you live in Iredell County, to practice social distancing as is requested and required under the governor's order. I would also say this: we have asked for the opportunity to be able to transition to phase 2 or phase 3 based on our individual counties' metrics. Although that request has been made, we have not heard anything back from the governor's office or from any of his staff. We will continue to ring that bell and see if we can't get a response as to why we can't move forward as a county if we meet the required metrics. But in the meantime, we have to follow the law, and the law is being set by the governor statewide. I will say this, we don't have any details on how phase 2 looks, but it will involve a considerable loosening of business restrictions, particularly for those close contact service industries like barbers and beauticians and manicurists, as well as our restaurants and bars and gyms and other activities that are focused on larger groups and a social bent or a close contact situation regardless. So stay tuned for those details as they come out. Finally, I'll mention again, we've seen a significant reduction of 911 calls to our EMS service. We don't believe that's because people are suddenly not experiencing a number of health conditions that heretofore they would have called and sought treatment for. So the initial stages of heart attacks, potential strokes, all of these are acute conditions that are need immediate treatment and intervention. A lot of people, we believe, are not dialing 911 or seeking medical advice because of concerns over getting COVID-19 if they leave their homes and go to a hospital. Let me assure you, the hospitals are a safe place to go to. They maintain social distancing, they have plenty of masks, they are equipped to deal with whatever your situation is safely. If you put off dialing 911 or going to the emergency room or consulting your physician, then by the time that early sign presents itself as an acute situation, there are a lot of treatments that are no longer as effective in terms of limiting damage or potentially even stopping someone from dying of a condition that could have been prevented. So we don't want anyone to not go to the hospital if they need to, or if they think they need to. Finally, happy Mother's Day. This will be a different Mother's Day than most any that we've had in the recent past. Probably not going out to eat, but we will have that opportunity to have some good quality time with Mom and Grandma. Take care, and God bless.